Okay, so this is a new thing, healthcare management technology or HMT. That's going to be a very close part of healthcare industry. Already has become, in fact. There are medical devices, there are medical equipments. Medical device is the article, instrument or apparatus or machine that is used in prevention, diagnosis or treatment of illness. Then medical equipment is used for specific purpose of diagnosis and treatment of disease or rehabilitation. Now the topic for this session was, and it was supposed to be the first presentation in this session, what are the opportunities and what are the challenges? So the few things, I think the first opportunity is to develop guidelines and protocols for various healthcare applications, where equipment safety is critical component of patient safety. I am coming from a organization whose existence revolves around patient safety, so there goes my first thought, that there should be standards for it to promote cost-effective use of medical equipment along with patient safety. The second opportunity may be awareness about equipment safety itself. Because wherever equipments are being used, there are always a scope of human error, and it is coming in light. The people are started talking about it. It's like how these equipment errors contributes in casualty. Then the third opportunity may be to develop trained personnel for maintenance. We can start some training and certification programs, and the training for the users, for the staff in the hospital who are using these equipments, medical technology. Other opportunities may be public-private partnerships, device incident reporting, internal review, and sharing it with other bodies, and techno-vigilance, that is innovative healthcare, just like pharmacovigilance. Then teleradiology and other things, we already have heard about it in detail from previous speakers. Then this micro-electromechanical systems, mobile applications, or then what are the challenges? Again, speakers before me elaborated on this, like how grave the situation is. And like Mrs. Pava mentioned, and I agree, it's a horrible fact that Indian women travel 27 times the distance between moon and earth just to fetch water. So here lies the challenge of innovations, especially medical technology. And Dr. Praveen has beautifully described it, that what are the challenges, what are opportunities. These are in different words, I would say. And now here comes what's the role of accreditation. What's the role of accreditation in medical technology? So NABH standards address this issue in one chapter, which is called Facility Management and Safety. It is chapter 8. There are 3 standards, and then there are objective elements behind these 3 standards, and these are being audited during accreditations. These are the few points which are specifically being reviewed during assessments or audits. Like when our assessors, auditors goes, we see how the budget are planned for equipment to start with. Then what this equipment purchase committee functions, who are the members, how they plan, how they project the future requirement. What is the plan for preventive maintenance? What is the plan for calibration and traceability to international standards? What are the measures taken for employee safety? Then documentation, record keeping. And this is, of course, this is one of the first and important requirements which is being reviewed during accreditation process, the legal and regulatory compliance. About very important is Atomic Energy Regulatory Board requirements, where most of the hospitals have to, they face challenge because there is not much awareness, and So NABH has started education workshops, especially on this topic, like what are the legal requirements, what are the proper waste management after equipment use, like nuclear medicine waste or radiation waste, proper signages, no smoking policy in these areas, and periodic regular review of effectiveness of the system. Another few more points during accreditation process which address the equipment part or technology part is safety plan, which is an essential requirement for every healthcare provider. How the safety committee is being constituted, what are the terms of references, how they document their minutes, how they fulfill their responsibilities, whether this material safety data sheet exists in the organization. Then there should be a system of continuous monitoring and analysis of sentinel events. Many of you here in this room, I can see, are from accredited hospitals, and you are very well aware. This is the requirement in coming time which can help in medical technology industry to control some of the abuses related with that industry. Okay, I will not go into detail. These few slides were made for in various areas how a different objective element addressed to that particular area. I will not go into detail of all these. So here comes the last slide of my presentation. Thank you.